We welcome Dr. Radheshyam Naik with us today. Thank you so much, Doctor, for joining us. We are going to have a very wonderful session with Dr. Radheshyam Naik. He is a medical and hemato-oncologist with more than 30 years of experience. Dr. Nayak is well versed with the latest treatment for different type of cancers, including chemotherapy, targeted therapy, and bone marrow transplantation. He'll be sharing his insights on the topic, treatment options in most common type of cancers. Thank you so much. And Dr. Radheshyam, over to you. I will invite you to speak about this. And thank you so much once again for joining us. Thank you.
Thank you very much. I want to welcome and greet all of you for this meeting on World Cancer Day, which is a very, very special day for all the oncologists and the patients, their family. And I want to thank ZenOnco for this kind invitation. And I want to restrict myself for 20 minutes. That's what I thought is the time given to me. So if you look at cancer, with the experience which I have of 30 years, so we can look at the various treatments as local treatments and systemic treatments. And we know that surgery and radiotherapy are the local treatments which treat cancer, local cancers. And then there are systemic therapies which are chemotherapy, hormone treatments, anti-angiogenic treatment, immunotherapies. And over the years now, hundreds and hundreds of different kinds of drugs have come into oncology practice, making it very complex decision making. But I'm not going to talk about these drugs right now because today is the World Cancer Day, where we have to talk about the accessibility, the gap in the care and all that. And I will look at a few factors which have prevented patient accessibility to the best of the therapies. If you take the most important accessibility factor, it is the cost. So there are a lot of patients who deserve the particular treatment, who know about the treatment, but who will not be able to take because of the cost constraints. Either the drug will be expensive, as happens in immunotherapies, targeted agents and all that, or the drug may be relatively cheaper like chemotherapy, but the toxicity will be more and the treatment of the toxicity is expensive. And we know that at least in the private sector, hospitalization itself is expensive. So we cannot take the drug cost by itself. The implications of the total cost is far beyond the cost of the chemotherapy drug itself. So cost is an issue, and we try to deal with that in several ways. One of the ways in which I used to deal was trying to make the patients, affordable patients, to sponsor my non-affordable patients. Then second is to request the pharmaceutical companies to give some free samples for our patients. And of course, crowdfunding and philanthropists giving the treatment, the hospital management reducing the cost of the therapy, and all that is what we used to follow. But all that was a very patchy effort. And the only real solution for this will be widespread accessibility to insurance, which even today, unfortunately, has not penetrated fully. And even when insurance is available, it is much less than what is optimal. You have usually 5 to 10 lakhs of worth of insurance, and most of the cancer therapies go much beyond the 10 lakh limit. So cost is one issue. That is not the only issue. The second issue will be accessibility. For example, if you are in a rural area and you have to travel to the city for treatment, many times either it gets delayed or it can be patchy, and many times you may stop treatment because of the accessibility issues. And the third issue which I have seen in large number of patients is ignorance about the treatment. Many times they think that the toxicity of the treatment is too much, and so they even though they can afford, they will not take the treatment, or they take a treatment and with some side effects, they are afraid for further toxicity and they stop treatment and go away for some other alternate treatments. So it is not only the cost, but also about misconceptions about the treatment. And they don't look at the temporary side effects being worthwhile, because ultimately the cancer is going to get controlled. The toxicity is not only for chemotherapy, it can be for targeted treatments, it can be for hormone therapy as well as the immunotherapies. And especially the immunotherapy and targeted treatments are very expensive. But if in addition to that, if they produce toxicity, many patients will not be able to take. The fourth issue is many of the times patients take treatment until the cancer gets controlled. But once they become symptom-free, they stop the treatment because they think that this treatment is enough. And anyway, doctors will advise whatever treatment they want, but we have to decide how much to take. And promptly the cancer will come back because they have stopped the treatment. So this also is part of ignorance.
Right.
The fourth issue, sorry.
Yes, doctor. Also, we have a few questions, but we can take this after.
Yeah. I'm going to finish in another 2 minutes, 3 minutes, then we can take the questions. And the fourth thing will be the availability of the drugs, especially the newer drugs, which are the research drugs, which are available in the West, in US and Europe, which are not yet available in India. Sometimes it is very difficult to access those drugs even for patients who can afford it. And oncologists also are constrained because of this, and we may not be able to give optimal therapy. And so these are the accessibility gaps we have got. And the way we can deal with that is, of course, one, increasing the insurance and reducing the cost of the treatment. And third will be widespread public education about the cancer biology and what cancer therapy should be. And about the toxicity, I think we should upfront tell the patients that these are the toxicities, so they are prepared. And most of the patients who are prepared well beforehand, I think they take the treatment to the logical conclusion. Thank you very much. And if there are any questions, I will be happy to take them.
Right. Thank you. Thank you so much, doctor, for sharing insights on this. We have a question. Can lifestyle changes impact blood cancer treatment outcomes?
Blood cancer?
Yes.
Okay. Lifestyle changes can affect cancer therapy, but in the situation of blood cancer, it is a little more difficult because most of the blood cancers are acute in nature, and there I think the change in the lifestyle is, I think, too late to come. See, the major impact of lifestyle is in prevention of the cancer. So I think we should look at that. For example, stopping smoking, not starting smoking, moderation in alcohol, controlled body weight, right diet, exercise, and all that should be more for prevention. And to an extent, it is useful even when in cancers, but mostly in solid cancers.
Right.
And especially useful in patients who have done well, who are in complete remission right now, so that they don't have recurrence of cancer or they don't get the second cancer. I think there the lifestyle changes play a major part. But even in cancer patients who are undergoing treatment, we recommend lifestyle changes because one is it doesn't do any harm, and second is they have some impact on the disease progression. For example, when patients on therapy, chemotherapy, they continue smoking, it has been seen that there is faster disease progression and more toxicity with the treatment and more resistance to the effect of the treatment. So to that extent, and I think taking lot of fruits, vegetables, and all that, and limiting meat and animal fat is good for everybody, even for other points of view, like cardiac point of view also.
Great, thank you. Thank you so much, doctor. डॉक्टर रिक्वेस्ट है कि अगर हम लोग कुछ वर्ड्स से कुछ टॉपिक्स पे हिंदी में बात कर सकते हैं तो ज्यादा लोग रिलेट कर पाएंगे। जो अगर आप में से किसी को कुछ भी क्वेश्चंस हैं तो अपने क्वेश्चंस चैट में लिख सकते हैं या फिर आप अपना हैंड रेज कर सकते हैं, तो हम आपको अनम्यूट करने का रिक्वेस्ट करेंगे। थैंक यू डॉक्टर। नेक्स्ट क्वेश्चन है अर्ली डायग्नोसिस ब्लड कैंसर ट्रीटमेंट में कितना मैटर करता है? उसमें भी ऐसा होता है कि अगर डायग्नोस अर्ली हो गया कंपेयर टू सॉलिड ट्यूमर्स, सो ट्रीटमेंट चेंज होता है या फिर आउटकम्स डिफरेंट होता है या फिर सर्वाइवल रेट्स डिफरेंट होती है ब्लड कैंसर के केस में अर्ली डायग्नोसिस के लिए, और वो अर्ली डायग्नोसिस हम कैसे कर सकते हैं?
अर्ली डायग्नोसिस सॉलिड ट्यूमर में एस्टैब्लिश्ड है कि अर्ली डायग्नोसिस से ट्रीटमेंट इफेक्ट ज्यादा होगा। इसमें पेशेंट का कंडीशन भी इम्प्रूव हो जाएगा, क्विकली इम्प्रूव हो जाएगा और ट्रीटमेंट का इफेक्ट भी अच्छा हो जाएगा। बट ब्लड कैंसर में इतना एविडेंस नहीं है कि अर्ली डायग्नोसिस क्या है, क्योंकि ब्लड कैंसर शुरू से ही बोन मैरो और ब्लड को इन्वॉल्व किया है। इसमें इससे स्टेज 4 ही हो जाएगा पहले से ही। बट स्टिल if patient is in a good condition and then the patient gets treated early, most probably they will do better with the early treatment of blood cancer. And there is no definite way of diagnosing patients early, but we know some certain things which increase the chances of blood cancer. For example, smoking itself. Smoking is one of the reasons for blood cancer. Exposure to industrial pollution like benzene and all that, and these are the two, and environmental radiation. These are the 3 different causes of blood cancer, and it is possible to some extent to avoid these exposures. And in a doubtful case, it is better to take an opinion of a oncologist or hematologist so that the diagnosis becomes easy very early.
Right. Thank you, doctor. Very important insights. पहले अगर डायग्नोसिस हम कर सकते हैं तो सर्वाइवल चांसेस भी काफी ज्यादा बढ़ते हैं। एंड डॉक्टर वांटेड टू हियर योर थॉट्स ऑन इंटीग्रेटिव ऑन्कोलॉजी, होलिस्टिक केयर इन कैंसर। हम लोग बात करते हैं कि बहुत ही कॉम्प्रिहेंसिव और होलिस्टिक हीलिंग करनी चाहिए या फिर वो कैंसर ट्रीटमेंट में और उसके आउटकम में बहुत मैटर करता है। सो जैसे कॉम्प्लीमेंट्री थेरेपीज, डाइट हो गया, योगा, इमोशनल वेलनेस, meditation, etc., integrating this into medical treatment. So what have you experienced in your practice कि patients को इसका कैसे रिजल्ट मिला है या फिर किस टाइप के क्वेश्चंस पेशेंट्स आपसे पूछते हैं और आपकी खुद की राय क्या है इसके बारे में?
My own experience is it is very important to integrate oncology with alternate medicines. Especially the nutrition aspect has to be taken care of. Physical therapies, especially yoga, is very important. Cancer definitely is not only disease of the body, though it starts as a disease of the body. It can be even have a bigger impact on mind than on the body actually, and it will affect the most of the aspects like social aspects, financial aspects, occupational aspects, spiritual aspects. I still remember a patient who had a lot of physical, mental issues, but his major issue was spiritual. Why I got this, though I am a man who was believing in God and doing all good things in my life, why did I get cancer? And that fellow never became good until we tackled that spiritual pain which he used to have. We call that spiritual pain because that is a problem which eats you away. And until we could tackle that, we couldn't tackle his physical problems. So, though cancer is of the body, it can affect other aspects much more. I remember one old patient whose main worry was that his daughter-in-law was not allowing him to play with his children, his grandchildren. And he was saying that I am ready to take all this pain, I am ready to die also, but my major worry is that this is not happening. So there is a social and familial issue. I think that has to be tackled if you want to treat that patient well. You cannot say that I will give you chemotherapy and you look after your problem. So it has to be multifactorial and multi-speciality kind of involvement. Nutrition, for example, unless you take care of nutrition, your treatment can never be successful. Exercise, for example, 15% of the cancers are supposed to be prevented by exercise, yoga, and all that. And many times the cancer progression can come down on exercise, or at least stall for some time on exercise. These are the issues which have to be kept in mind.
Thank you, doctor, because after having great experience of 30 years, you are sharing your learnings where focusing on holistic healing and a very well-balanced lifestyle can actually prevent cancer also in 50% of the cases. And this is a very important message that we all take home because we feel that हमें तो नहीं होगा और जब होता है तो एक शॉक की तरह आता है. So how
Yes.
can we at least try to reduce chances of getting cancer or any other chronic illness for that matter. So
Yes.
hearing this from such an renowned oncologist like yourself, doctor, it really means a lot, and I'm sure that we all will try to incorporate this in our daily lifestyle as well. Thank you. Yeah, we have a question. If we want to prevent blood cancer, what can we do for that? Blood cancer prevention के लिए हम क्या कर सकते हैं?
Okay. The problem with blood cancer is compared to other solid cancers, it is a rare cancer, rarer cancer. Now, I won't say it is very rare, but it is rare compared to, for example, breast cancer or lung cancer or colon cancer. Secondly, we do not exactly know the reason for many of the types of blood cancer. So, since it is rarer and we do not exactly know how it is produced, in many cases, it may be difficult to prevent the blood cancer. But there are some issues which you can keep in mind. One is you should not smoke because smoking is a definite known cause for one blood cancer. The second thing is we also know that you should not be exposed to some of these industrial pollution, and that of course requires governmental regulation. And we all as responsible citizens should pressurize the government to tackle that issue. The third thing is, if you have a doubt, if maybe a family physician has a doubt or any patient has relatives have doubt, immediately better to go to a hematologist or an oncologist quickly and get your diagnosis quickly, because if you are in good shape and you have blood cancer, your chances of cure are much higher than if you are in a bad shape and have blood cancer.
Right. Great. Thank you, doctor, for sharing. एक question है रतन मेहरा का. What are the possible treatment for solid fibrous tumor?
Solid fibrous tumors. I don't know exactly what she means by that.
Okay.
But if it is, there can be cancers and there are non-cancerous fibrous tumors. There can be benign tumors. If it is a benign tumor, most often the surgery is the treatment of choice. If it is cancerous, of course, we have to decide. For example, it can be a fibrosarcoma or fibrous histiocytic sarcoma. So these tumors, of course, surgery is the major treatment, but they have to be followed up with radiation and chemotherapy.
Great, thank you. Is there any immunotherapy available in case of liposarcoma? Liposarcoma के लिए कोई immunotherapy available है क्या?
Small percentage of sarcomas, including liposarcoma, can express PD-L1, and they can have a immunomodulatory environment. In that case, immunotherapy can work, but not alone, along with chemotherapy or radiation. And some of the patients do well with liposarcoma on immunotherapy. We have had few patients who did well. Of course, majority of the patients don't respond to immunotherapy if they have liposarcoma.
Right. Okay. Thank you. I will take last one more question. Right. Post CA breast early stage after surgery, 6 chemo and 17 hormonal therapy. Still sometimes for any kind of itching, I still get scared how to manage this treatment. Is completely done more than 2 months back. So treatment 2 महीने पहले खत्म हो गया है. But अभी कभी-कभी itching sensation होता है तो लगता है कि कुछ बड़ी प्रॉब्लम तो नहीं है. So इसको कैसे मैनेज करें?
Yeah. See, after surgery, what happens is during the surgery, some of the subcutaneous nerves in the skin and subcutaneous tissues would have been partially damaged because of the surgery and radiation. And they will be sprouting sometimes, and they will cause this small amount of pain or irritation. And most of the times, I think it is not harmful at all. But it is better to check with your surgical oncologist and radiation oncologist and make sure that it is not recurrent. Very unlikely that it is early cancer, so early not likely to be recurrent, but it is better to take an opinion. Most 99% of the time, it will be not harmful.
Okay, sorry. Thank you so much, doctor, for sharing this.
Thanks.
And आज जो आपने हम सबके साथ में इतना सारा इन्फॉर्मेशन शेयर किया है, उससे हम सबको बहुत कुछ सीखने को मिला है. एंड कैंसर की जर्नी हमेशा काफी कॉम्प्लिकेटेड होती है और हम सब यही चाहते हैं कि हम इस जर्नी को अच्छे से मैनेज कर पाएं. And thank you. We are fortunate that there are great doctors like you who give hope, inspiration, guidance, and a path to others to walk in the right direction when they get diagnosed with cancer. Thank you once again, doctor.
Thank you. Thank you very much.